Hello everyone, welcome back to the Medi queries. So students, today I am not going to start our class with a complicated definition. So instead I have a very simple question. So imagine I take a stone and drop it into a water. What happens? Yes, it sinks. So now imagine I place a small boat on the same water. What happens? It floats. So but both are under the influence of gravity here. So why does one sink and other float? So think for 5 seconds. So the important concept is density and buoyancy. So now here is my interesting pharmacy question. So what if a tablet could behave like a boat? So normally when we swallow a tablet, it enters the stomach and later moves towards the intestine. So but can we design a tablet that enters the stomach? So floats on gastric fluid. So stay there for a longer time and slowly release the drug. Yes. The pharmaceutical scientists have already done it. So these dosage forms are called floating tablets. So today we are going to understand their definition, principle, mechanism, polymers, gas generation, advantages, limitations, evaluation, and even perform a simple classroom activity also. Today our tablet is not going to sink. So it is going to float. What if a tablet could float? So look carefully at this image. On one side we have a normal tablet that sinks. On the other side we have a tablet staying on the surface. Students, tell me which tablet may remain in the stomach for a longer period? Exactly, the floating tablet. So think of a normal tablet like a passenger traveling on a fast bus. So it enters the stomach and may quickly continue its journey. So a floating tablet is more like a boat staying in a harbor. So it remains in the gastric region for a longer period here. So this idea forms the basis of the floating drug delivery system. Okay, is it clear? So normal tablet journey. So first let us understand the normal journey of a tablet here. So we swallow the tablet, it passes through the esophagus, then it reaches the stomach. The stomach contains the gastric fluid. So after some time the gastric emptying pushes the dosage form towards the small intestine. Students, imagine a railway station here. So the tablet enters the stomach station, but it does not always stay there for a longer time. So the stomach may say, your time is over, next station, intestine. So this become a problem of some drugs. Why? Because certain drugs need more time in the stomach or upper gastrointestinal tract for effective absorption here. Okay. So here comes our pharmaceutical problem. So a conventional tablet may move relatively quickly from the stomach into the intestine. Suppose a drug has a narrow absorption window in the upper GI tract. So if the tablet passes that region quickly, what may happen? So drug absorption may become incomplete here. Okay. So bioavailability may also decrease. So students, imagine you have only 10 minutes time to enter an examination hall. So if you miss that 10 minutes window, so can you enter later? Maybe not. So similarly, some drugs have limited regions where absorption is favorable. So this is called narrow absorption window. So pharmaceutical scientists asked, so can we keep the dosage form in the stomach for longer? And the answer was yes. So design a tablet with a density lower than the gastric contents. So the tablet can remain buoyant on the gastric fluid here. So look at the tablet in our image. It behaves like a tiny pharmaceutical boat. So students, complete my sentence. Boat floats on water. Floating tablet floats on gastric fluid. Excellent, no? So this prolonged presence in the stomach is called gastric retention. Okay. Now let us frame a scientific definition. So floating tablets are the low density gastro-retentive dosage forms designed to remain buoyant on the gastric fluid for a longer period without markedly affecting the gastric emptying, so while releasing the drug in a controlled manner. Students, don't simply memorize the entire definition here. So remember 4 keywords, that is low density, buoyancy, gastric retention, controlled drug release. So if you remember these 4 concepts, so you can construct the definition in the examination easily. Okay. So now we come to the heart of the topic, the principle. So look at the stone, it sinks. Look at the boat, it floats. Why? So the basic concept is the buoyancy. So for floating dosage forms, the apparent density of the system should be lower than the gastric fluid here. So when the upper buoyant effect can maintain the dosage form at the surface, the tablet remains floating. So students, imagine a balance between the two forces. So one is the downward effect associated with the gravity and the other is the upward buoyant force. So our formulation is designed to maintain the buoyancy. So remember, this is simple classroom line. Lower density leads to the buoyancy and the buoyancy supports the floating. Okay, everybody repeat: low density, buoyancy, floating. Very good, no? So now watch the mechanism like in a 4-step movie. So step 1, contact with the gastric fluid. So the patient swallowed the tablet and it enters the stomach. So that is about the first step. In second step, what will happen? The polymer hydration will take place. So hydrophilic polymer present in the tablet absorb the fluid. So imagine a dry sponge placed in your water. So what happens? It absorbs water and swells. Similarly, the polymer hydrates and forms a gel layer here. In step 3, gas generation and entrapment takes place. So in an effervescent floating tablet, a gas generation agent may react in the acidic conditions here. So carbon dioxide is generated. So the hydrated polymeric gel helps trap the gas here. So imagine small bubbles trapped inside a soft network. So the effective density of the tablet decreases here. And step 4, floating. So the tablet becomes buoyant and remains on the gastric fluid. So students, tell me the sequence here: contact, hydration, gas entrapment, floating. So now let us focus on the carbon dioxide. So a commonly used gas generating agent is sodium bicarbonate. So in an acidic environment, the sodium bicarbonate can participate in the reaction that release the carbon dioxide here. So you can remember the basic idea as bicarbonate plus acid produces the carbon dioxide gas. So look at the bubbles in the image. So these bubbles are not just decoration. So they have a pharmaceutical purpose. The gas becomes entrapped within the hydrated polymer matrix and helps reduce the tablet's apparent density here. So think of a life jacket. So why does a life jacket help a person float? So it contains a low density buoyant materials or trapped air. So similarly, entrapped gas assists the tablet in remaining buoyant here. So students, here is an important question. If carbon dioxide is generated, why does not it immediately escape? Excellent question, no? So this is where the polymer becomes important. So only commonly used hydrophilic polymer is HPMC, that is hydroxypropyl methyl cellulose. So when HPMC contacts the gastric fluid, it hydrates. So it forms a viscous gel layer around the tablet. So imagine wrapping the tablet with a soft hydrated protective sponge. So this gel performs 2 important functions here. First, it can help retain the generated gas, and the second, it controls the penetration of the fluid and diffusion of drugs. So the polymer is not simply in a inactive material. So in the dosage form design, it has a major functional role here. Students, quick question. So name one hydrophilic polymer used in the floating tablet. Yes, it is HPMC. Okay. So slow drug release. So now our tablet is floating, right? So but what happens to the drug? So the drug is released gradually from the hydrated matrix here. So look at the small drug particles moving away from the tablet. So this represents the controlled or prolonged release. So imagine watering a plant. So if I throw 10 liters of water at once, much of it may be wasted, right? So but if I use a drip system, water is supplied slowly over long period of time. So a controlled release dosage form also follows a similar concept here. So the aim is to release the drug at a predetermined or controlled rate. So our tablet has two major design goals, that is staying in the gastric region for longer period of time and release the drug gradually. Okay, so these two goals are needed to be reached. Okay, so types of the floating systems. So floating systems can broadly be discussed as effervescent and non-effervescent systems. First, the effervescent systems. So here a gas generation is highly involved. So carbon dioxide is produced and then trapped within the hydrated matrix here. So think of a fizzy reaction. Second, the non-effervescent system. Here floating may be depend mainly on the polymer swelling, gel formation and low density characteristics rather than the intentional gas generation. Okay, think of a sponge. So a sponge can swell and maintain a porous structure. So students, I will ask you, so which system involves the gas generation? So what's the answer means? Effervescent system. So which system mainly uses swelling or the gel forming properties? That is non-effervescent system. Perfect, no? So why do we spend so much time designing the floating tablets? So because they can offer important advantages for the suitable drugs. So first, prolonged gastric retention. So the dosage form may remain in the stomach longer period here. And the second advantage is controlled drug release. So the drug release can be prolonged. Okay. And third one is improved bioavailability in suitable situations. So especially when prolonged residence near the preferred absorption region is beneficial here. And the fourth one is better. The therapeutic performance may be possible for appropriately selected drugs. Okay, so but students, one important scientific point here is floating tablets are not automatically better for every drug. So drug selection and formulation designs are extremely important here. Now let us ask a practical question. So which drugs may be considered for gastro-retentive floating system? So one category includes the drug associated with the narrow absorption window in the upper gastrointestinal tract. Okay, so imagine a camera scanner placed only at the entrance of a building. So if the person quickly passes the scanner region, the opportunity is lost. Similarly, if a drug is absorbed in a particular upper GI region, prolonged gastric residence may help maintain the drug availability near that region only. Is it clear? So other formulation considerations can include local action in the stomach and the drug behavior in the gastrointestinal conditions. So students, remember here, so the dosage form must be designed according to the properties of the drug here. So we never choose a delivery system simply because it looks interesting. Okay. Limitations. So every pharmaceutical system has some limitations. So floating tablets are no exception here. So first, their performance can be influenced by the food and the gastric conditions. The fed and the fasted states can affect the gastric physiology here. Second, they are not suitable for all drugs. Third, the drugs with unsuitable stability or solubility characteristics in the gastric conditions may present the challenges here. Fourth, gastric motility varies from person to the person. So students, look around your classroom. So are all students exactly the same height? No. Exactly the same weight? No. Similarly, gastrointestinal physiology can vary among the individual. So this biological variation can influence the gastro-retentive performance also. So when we discuss the advantages, we must also scientifically discuss the limitations. Okay. Evaluation tests. Now imagine you prepared a floating tablet in the laboratory. So can you simply look at it and say, beautiful tablet, my formulation is successful? No, no. So the pharmaceutics require the evaluation. First, floating lag time. So this is the time taken by the dosage form to rise to the surface and begin floating under the specific test conditions. Okay, suppose I place a tablet in the media, it floats after 20 seconds. So the floating lag time is approximately 20 seconds here. Second, total floating time. So how long does the tablet remain floating? 2 hours, 8 hours, 12 hours. So that duration is also important here. And third is in vitro drug release. So we evaluate the amount of drug released over time. Fourth, swelling index. So this helps assess the extent of swelling. And fifth is drug content. So we determine whether the tablet contains the required amount of drug or not. Students, quick question here. Here is a small quick question. So lag time means time to start floating or total time floating. So time to start floating, okay? Is the right answer. Excellent, no? Now in vitro floating studies. So look at this beautiful sequence. At 0 seconds, the tablet is introduced into the test medium. Initially, it may remain below the surface. So after a short period, hydration and the gas generation occur. So the tablet rises. So this initial period is associated with the floating lag time. So then the tablet remains buoyant. So the duration for which it remains floating is recorded as the tablet floating time here. So students imagine a rocket. There is a short preparation and launch phase. So then it moves upward. So for our tablet also, the analogy is only to help remember the timing concept. Okay, so before floating, lag time, duration of bioevents, total floating time. So write these 2 points in your notes clearly. Okay, so now summarize the entire floating tablet concept in 3 words, that is float, stay, release slowly. So float on gastric fluid, stay in the gastric region for a prolonged time, and release the drug in a controlled manner. So if you understand these 3 lines, so you understand the basic purpose of a floating drug delivery system. So Medi queries connection. So at Medi queries, our aim is not just to memorize the pharmacy definitions. We want to visualize the pharmacy. So when I say floating tablet, I want you to imagine a tiny boat. So when I say polymer hydration, imagine a sponge absorbing the fluids. So when I say gas entrapment, imagine air trapped inside a life jacket. So when I say controlled release, so imagine a slow drip system. So connecting scientific concepts with the familiar examples make learning easier. Okay, so let us revise the advantages in a little more detail here. So prolonged gastric retention means the dosage form can remain in the gastric region longer than a conventional rapidly passing dosage form under suitable conditions. And control release means the formulation is designed to regulate the drug release over time. And improved bioavailability may occur for appropriately selected drugs when the delivery system improves the residence near a favorable absorption region. So floating systems may also be useful when a prolonged drug presence in the stomach or upper GI region is desirable here. So students, I have a question. So if a drug is mainly beneficial when available in the upper GI region, so would rapid passage always be ideal? The answer is no. So this is the formulation problem floating systems attempt to address. Now let us critically analyze the limitations. So food can influence the gastric residence here. So gastric conditions can vary. So individual physiological differences can affect the performance here. So not every drug is a suitable candidate, and a drug that is unstable in the strongly acidic gastric conditions may create the formulation challenges. So please don't write in an examination floating tablets are suitable for all drugs. So that statement is incorrect. So instead write, so floating systems require careful drug selections based on the physiochemical, pharmacokinetic and the physiological considerations. So that sounds scientific and demonstrates understanding. Factors affecting gastric retention. So several factors can influence the gastric retention. So look at the first image, food. So fed or fasted conditions can influence the gastric behavior. Second, meal size and nature. So the composition and the quantity of the meal may influence the gastric emptying. And the third one is the frequency of the food intake. So repeated meals may alter the gastrointestinal patterns. And the fourth one is the dosage form properties. So size, shape and density can influence the gastric retentive behavior here. Okay, and fifth is the individual variation. So physiology differs among the individuals. So students, think of the traffic. So does a vehicle take exactly the same time to reach the college every day? No. So traffic changes, road condition change. Similarly, gastric conditions are dynamic here. So that is why gastro-retentive drug delivery is an interesting and the challenging research area. Okay, conventional versus floating tablet. So now look at the comparison. So a conventional tablet may pass through the stomach as a part of the normal gastrointestinal transit. A floating tablet is designed to remain the buoyant and increase the gastric residence under suitable conditions. So students, I want one side of the class to say conventional tablet and the other side floating tablet. So conventional group, what happens? Passes onwards. Okay, floating group, what happens? So floats and stay longer here. Excellent, no? So this simple comparison can be a very useful during revision. So here is a rapid revision. So now close your notebooks. I am going to test your memory. Low density helps what? It's buoyancy. Polymer hydration forms what? Gel layer. In an effervescent system, which gas is commonly generated? Carbon dioxide. The tablet remains where for longer? Stomach or gastric region? Drug is released how? Slowly or in controlled manner? Excellent. So our complete mechanism can be remembered as here, that is hydrate, gel, trap gas, float, retain and release. So repeat once: hydrate, gel, trap gas, float, retain and release. Now it is quiz time. So question 1. So what does GRDDS stands for? So gastro-retentive drug delivery system. Question 2. So what is the main principle of the floating tablets? Low density buoyancy. Question 3. Name one hydrophilic polymer. Answer is HPMC. Question 4. So name one gas generating agent. Answer is sodium bicarbonate. Question 5. What is a floating lag time? So the time required for the dosage form to rise to the surface and begin floating under the test conditions. Question 6. So what is the total floating time? So the total duration for which the dosage form remains buoyant. So students, give yourself 1 point for every correct answer. So 6 out of 6, excellent. 4 or 5, very good. Below 4, revise the mechanism once again. Okay. Now it is activity time. So for a simple classroom demonstration, take 2 transparent glasses containing water. So we are using the water only for Biovent concept demonstration. So it is not a pharmaceutical evaluation test and does not reproduce gastric conditions. So take a small stone. So place it in the first glass. Observe. So what happens? It shrinks. So now take a light floating object such as a small clean piece of foam or another safe Biovent classroom objects. So place it on water. So what happens? It floats. So what is the difference? So discuss the density and Biovents. So next, draw a table on the paper. Write inside it the polymer plus gas generating system plus drug. So draw the glasstic fluid around the table. Next, draw a tablet on paper. So write inside it polymer plus gas generating system plus drug. So draw the gastric fluid around the tablet. Show polymer hydration. So draw tiny CO2 bubbles. So show the bubbles being retained within the hydrated matrix. Finally, draw an upward arrow and write the reduced apparent density, buoyancy and floating. So students, remember this is a conceptual model only, so do not use medicines for the casual home experiments and do not treat water testing as an official floating tablet evaluation. Okay, so students, now take a white chart paper. At the center, write in a big colorful title, floating tablets. Below the title, write the stay afloat, release slowly. So on the left side, create a box called definition. So write your keywords low density, Biovent, gastric retention and control release. So below that, draw the principle, draw a stone shrinking, draw a boat floating. So write the low density, buoyancy and the floating. At the center of your portion, draw 2 beakers, label the first with sinking tablet, that is high for high density, and then label the second one with floating tablet for low density. So now make a mechanism flow chart. So tablet enters the stomach, polymer hydrates, gel forms, gas is entrapped, density decreases and the tablet floats. So drug releases slowly. So on the right side, draw a stomach containing the gastric fluid and the floating tablet. So add the advantages: prolonged gastric retention, control release, potential improvement in bioavailability for the suitable drugs. So better therapeutic performances in the appropriate formulations. So at the bottom, add the types, that is effervescent, non-effervescent. Finally, highlight one golden reason line, that is hydrate, gel, trap gas, float, stay and release. So present your poster to the class in 1 minute. So don't simply read it. So point to each diagram and explain the story of the tablet. Okay, so that is how a scientific posture become a learning tool here. So here I am giving some sample postures, so make it use for your reference. So students, today we are following the complete journey of a very special tablet. A tablet enters the stomach, the polymer hydrates, a gel layer develops. In an effervescent system, carbon dioxide is generated and entrapped and the effective density decreases here. So the dosage form becomes Biovent. So it remains in the gastric region for a prolonged period and release the drug in a controlled manner. So remember our 3 magical words: float, stay, release slowly. So if you found this video helpful and informative, please like, share and subscribe to Medi. Your support motivates me to create more simple, visual and the concept based pharmacy lessons. So keep learning, keep questioning, keep exploring the pharmaceutical science. So this is Medi. Learn pharmacy simply. So thank you so much for watching. See you in the next pharmacy concept.